I have our next presenter, Dr. Ravindra Kumar Chaudhary. Yeah, please.
Respected dignitaries on the dais and off the dais, a very good morning to all of you. My topic today is perception of faculties on online medical aviation. During COVID-19 pandemic, educational institutions worldwide shifted to online educations. However, these transitions presents challenge for institutions, instructors, students, necessitating rapid adaptation to this new mode of learning. So with this background, the present study was undertaken to discover the perceived advantages and disadvantages among the faculties. This understanding will enable us to leverage the benefit and address the drawback effectively. This is a cross-sectional observational study where a pre-tested semi-structured questionnaires on perception regarding online medical education was sent. Response were 100 questions were attempted were included in the study. The questionnaires were divided into the 4 sections. Section 1 consists of demographic profile. Section 2 consists of readiness to switch to the online mode, preparatory time required, internet speed, face-to-face interactions, and the section 3rd includes advantages and disadvantages of online teaching as well as online examinations. And 4th sections includes futures perspectives of these online educations. 121 faculty members participated in the studies, and 56.2% had more than 5 years of teaching experience. 39.7% of faculties were ready to switch to this online mode, and 52.5% of the faculties noted that there was adequacy of internet speed during their classes. And only 24.8% of our faculty members have experience of online teaching before COVID-19, and preparatory time is more in 52.7% of our faculty members. Coming to the advantages of online classes, classes can be taken at its own convenient time. Holiday and vacations can be used to complete the course. Minor illness of a students will not be a hindrance to the class. These are the major advantages, and the non-availability of high-speed internet, practical classes on online modes are effective. Lack of computer skill among teachers are disadvantages. Coming to the online examinations, it can be conducted during pandemics. Physical presence of external examination is not required. Manpower required to conduct the examination is less are the advantages, whereas students' integrity and difficulty in evaluation of answer sheets and practical examination are difficult to conduct are the disadvantages. And the lack of face-to-face interaction was perceived by 81%, and more discipline and integrity is required in 83.3% of our is required. And 91.5% of our faculty members want to need a workshop for online educations, and 91.7% of our faculty members want to implement this hybrid mode in future. So this is the comparison among senior and junior faculties. The major difference we noted is that most of the junior faculties are ready to switch to this online mode. Comparing with the Rohila et al., they have found no face-to-face interactions and internet issue were the commonly stated barriers, and provision of recording, glued platform for introvert students, social distancing and suitability of time are the major perceived advantages. This is the demographic profile comparison with other studies abroad and India. To conclude, 91% of our faculty are in favor of hybrid mode, but most of them need a workshop or training for a better implementation of online educations in medical college as per our study. And in view of the emergence of new medical college in remote areas nowadays, the online mode can be a solution to overcome these problems of shortage of faculty, as well as beneficial to the students to learn from an experienced teacher from a distance place. However, conducting examination in online mode as far as medical colleges are concerned, where the skill is examined, it should not be considered unless and until social distancing is mandatory. Thank you.
Yeah, I think it's a good study. How could you analyze regarding practical teaching of the students, clinical skills teaching?
Yes,
during this time?
Actually, this idea came to our mind while to conduct a study when we are teaching in the medical college during the COVID era. At that time, we were able to teach the theory part, but to conduct the practical examination, practical part is very difficult, as it is skill is required, and moreover, integrity of the student is required to be concerned. So whether the patient is learning well or not. And further, the examination, conducting examination, mainly the practical is the only drawback of this online mode.
Another thing that was a problem was the availability of internet. At many places, this Wi-Fi was not available, so that would disrupt the teaching, and that would affect the students also. So at some places, the teaching was affected because of the non-availability of a continuous internet supply.
Yes, yes, sir. Yes, ma'am. This is the major issue. By doing this, the purpose of doing this study is to that mainly these institutions need to provide high-speed internet speed. But during the COVID era, anyhow we have managed the situations. But further for the time, as it is linked to the competency-based medical education nowadays, and that mainly focus on online education, we have to provide online internet speed should be adequate. For this
Government
purpose.
agencies
Have to be aware, and it should be
And
implemented.
what was your experience in teaching surgical skill sets?
Surgical
Because
sets,
that was a limitation with online teaching and still remains a limitation with online teaching.
yeah, you can.
So did you do a further extension of your study on this aspect, that how was the effect of, how we were going for online, people are ready for online, but is it compromising on their surgical skills and physical training?
No, surgical skills that it will be beneficial in one way is that they can see their recordings or recording of the expert surgeons from the distance place. That is
Right.
one of the advantage online mode of, because
Right.
from in the same institute they can see the direct side, but from the online mode they can see from a distance place. That is one
Yes,
of the
so
important
live
things.
surgery workshops and all that were very useful.
Yes, sir.
But then if you don't do it physically, there was a limitation.
Yeah,
so
that is-
a
that
lot
is-
of people have
that
got
is
very
what the-
poor training during this period.
Yes, sir.
So you should have emphasized that on your talk.
Yes, sir.
Thank you.
Thank you, sir.